Greetings. I'm Dr. John Abramowitz from the University of North Carolina at Chapel Hill. And our group in 2007 was awarded a research grant from the IOCDF to study couples-based cognitive behavior therapy for OCD. I'm going to tell you a little bit about the study that we did and some of the findings that we had. In our study, we treated 20 couples where one of the partners was affected with OCD, and we gave them exposure and response prevention treatment that was specially designed for couples where both partners would work together on the exposures. The partners would learn how to reduce accommodation behaviors. They would learn communication skills. And we developed this treatment myself along with Dr. Don Balcom at the University of North Carolina. Dr. Balcom is a specialist in couples therapy. And so we like to say that it was a great marriage between myself, an OCD expert, and Dr. Balcom, a couples therapy expert. And what we found was that the outcome of therapy, both immediately after treatment and then also 6 months after treatment had ended, was just as good, if not better, than individual therapy for OCD. But we also found that the partners, the people who didn't have OCD, felt very, very grateful to be involved in treatment and felt like they had learned lots of skills to be able to help their loved one with OCD, to be able to manage with their OCD symptoms. And since that time, we've started to expand our work with couples to other areas, to OCD-related conditions, such as body dysmorphic disorder, such as health anxiety, and we've got some other studies with OCD that are coming down the pike. We're thinking about applying for future grants. One of the things that this research has helped us to do is to really learn about the importance of involving a partner, whether they're a spouse or some other sort of loved one, getting them involved in exposure therapy, in cognitive behavior therapy. Because we find that often patients, they do individual treatment, but then when they go back home, their family members, their loved ones, sometimes are more likely to kind of give in and do compulsions or avoidance strategies for the person with OCD to try to minimize anxiety and minimize distress in the household. And we found that when we could get families working together, that that kind of helped the loved ones to be able to help with exposure and response prevention the correct way by kind of saying, hey, I love you, I know you can get through this, rather than jumping in and doing rituals for the person. So I think that the impact of our study on the field of CBT for OCD has been really large. I think it's helped to get the word out that it is really important to involve a loved one. We really appreciate the funding from IOCDF because it really helped to get our research off the ground, and hope that this is valuable to learn about.